Namaskar. This is our Clinico state-of-art diagnostic center where we perform all kinds of imaging, PET-CT, CT, MRI, USG and other imaging modalities. I'll walk you through our center. This is the FDG elution area. We elute FDG behind these lead bricks and we measure it in the dose calibrator as per the patient's body weight, following which we give that injection to the patient. Here we take patient's weight, following which we take height, measure pulse, blood pressure, saturation. Then we make patients sit comfortably on this chair, put the venflon and inject the patient with the FDG. This is a patient waiting area where after the injection, patients sit with eyes closed and relaxed for about 45 to 60 minutes before we take the patient for the scan. This is our latest Discovery IQ Generation 2 state-of-art PET-CT scanner. The main indications of the PET-CT scan are in oncology, in infections, vasculitis, cardiac viability and in the neurology. PET-CT is a combination of cross-sectional anatomical imaging provided by the CT scan and the metabolic information is provided by the PET scan. Various tracers which are used to perform the PET-CT scan are FDG, which is fluorodeoxy-D-glucose, PSMA, prostate-specific membrane antigen, F-DOPA and sodium fluoride. In oncology, the most common tracer used is 18F-FDG, used for various indications for the diagnosis and staging of the disease, diagnosing unknown primary and known metastatic disease, for extent of the disease, to evaluate response to the treatment, for follow-up and recurrences of the disease. It is also used for selecting the biopsy site, pre-radiotherapy planning as well as pre-surgical planning. In infection, it localizes the site of the infection, extent of the infection, biopsy guidance, then differentiating between the joint prosthesis infection versus loosening, focal versus multicentric osteomyelitis, various inflammatory conditions like sarcoidosis, vasculitis like giant cell arteritis and Takayasu arteritis. It also helps us to assess the response to treatment. In cardiology, it is used to evaluate myocardial viability, cardiac sarcoidosis as well as amyloidosis. In infections, it is used to diagnose the extent of the disease and the biopsy site. In cardiology, it is used to evaluate the myocardial viability. In neurology, it is used to diagnose dementia like Alzheimer's disease, mild cognitive impairment, Parkinson's disease and atypical Parkinson's disease, epilepsy, tumors, and also it is used to differentiate between the radiation necrosis versus tumor recurrence. This is the active toilet which the patient uses after the injection and anytime before and after the scan.